So Dr. Vitor is PhD, also from Harvard, postgraduate from Harvard in endovascular surgery, and also working at the Hospital Albert Einstein in Sao Paulo, his medical residency in vascular and endovascular surgery. So with that, we move to Dr. Vitor to do the investigation. Thanks so much.
Thank you for your kind introduction. It's so good to be with you, share a little bit about our experience. I think you should close about our experience here in Instituto Lipedema. So first of all, what can be that we kindly ask the dental patient to be with us to show a little bit about the physical examination and then how we vascular surgeons can use the ultrasound as a device for understanding a bit more about where in the development of the disease the patient is and how can we help treat this patient. So first of all, as you can notice, we're gonna have the patient standing like this, and then we're gonna take a closer look to the areas in which we usually find lipedema pads. These areas are here medial right below the knee, medial right above the knee, and the area lateral to the hips. Okay, so in these areas, usually we'll have these so-called fat pads, and if we press it a little bit, the patient will tend to feel pain, tenderness, or something like this. When it's possible, you feel pain here. So usually they will feel more pain in here than in other areas of fat deposition. So here we can see a lot of fat tissue, and there is flaccidity too. But Wesley, tell us if the pain is the same. Dói igual ou dói menos lá embaixo? Yeah. So the fat pad areas are usually the places where we find more inflamed tissue. Then we're gonna stage this patient. She has lipedema in the hip area, the thigh area, and the leg area. So this would be type 1, this would be type 2, this would be type 3, which is her type right now, plus type 4, which includes VRs. Then the next way to classify this patient is with the stages. So the first stage, she would have only the fat tissue deposition, but the skin would be smooth and soft. And the second stage, we will have like this flaccidity, the skin is irregular, and we can feel fat nodules below the skin. The third stage, which is the case of this patient, we have folding, skin folding. Yes. So here we can see clearly the folding of the skin. Beneath the position of the fat, you're gonna feel the smoothness of the skin because it's always touching one side to the other side. And then the fourth stage would be lymphedema associated with lipedema. What I want to show you right now, I'm pretty sure you can take a look at the screen of our ultrasound machine. I want to show you what we can find under ultrasound. I'm gonna try to use my arrow here. Here is the dermal thickness of this patient, and we can see that as the lipedema progression evolves, we're gonna have a thinner skin than usual. And besides that, we have this so-called dermal indentations. It's just like the fat tissue is coming inside dermal tissue. We can see it in here like this. Yes, you can notice that the dermal tissue is not that clear as would be, let me show you, in another area like in the arms. But here we can see clearly the dermal tissue. Yes. And here we can see the white area, which means water, which means fluid deposition, and which means the disease tends to be progressive. And now I'm gonna tell you about what we look for specifically in the vascular part, because this patient is going to be operated in a few days through a project, an NGO project that we have here. And so we have to understand whether it would be safe to have her operated or not, like this. And please take a look at the skin here. When we examine the patient's leg, we can notice a few bumps here, but no clear bulging varicose veins. Yes, but whenever you see something like this spider veins here in a patient with this amount of lipedema, you should scan her prior to the surgery, because it's very frequent to find varicose veins beneath this area. And in this case, that's what's happening. And that's important because we don't want this patient to suffer from hematomas or thrombosis or any other complications related to this varicose vein during the liposuction. And this is a particular area of interest. Here we can notice the inflammation in the fat tissue here. Okay, look how white it is. And apart from that, we notice the dilation of the smaller subvenous vein. You can see it in here. And the right moment when an insufficient tributary comes out of it here. And then if you go further medially, you can notice that this varicose vein that we cannot see in our skin during the physical examination is actually very, very close to the skin. And then it will come down for at least 15 centimeters in the medial part of the leg and the posterior part of the leg. And then dividing in branches going all the way down here. So why is that important? Because we want to remove these varicose veins first, or at least prior to the removal of the fat tissue in order to avoid bleeding. Here, I think you can notice exactly the point where the venous reflux is leaking here, okay? And that's very important for the patient because we don't want the so-called complications, especially in this area that we know that could be tricky, as Fabio is going to show it. So closing, the importance of the vascular evaluation doesn't rely only on the subvenous aspect or the tributary aspect. We want to understand how the muscles of these patients are behaving in a manner of having the blood flow pumped again upwards. We want to understand how these vessels are connected to the skin, how we can treat this patient in the inflammatory part in order to have her prepared in a good way, in her best way, actually, to have the liposuction in a safe manner, and the results are going to be way better. That's it. Thank you.
Thanks so much, Dr. Victor. It was really interesting to understand and to see how the importance of doing the right vascular assessment before just moving forward to the next step. Having said that, I would like to invite Dr. Omar Farouk to share with us the first 4 questions. Please, we are using these 4 questions to get more interaction from the audience. You will have a 30 seconds to choose one of the options, and then we're going to discuss it afterward with Dr. Vito. So Khalid, please, the first poll. And to you, Dr. Omar.
Yes. The first question is very, very interesting, really, and I'm very eager to see the result. The question is, what staging of lipedema do you apply? So which system do you use? A, which is the first system, staging system as follows. Stage 1, smooth skin, slight swelling. Stage 2, uneven skin texture and nodule. And stage 3, large fatty deposits with deformity. Now the system B, I do no longer stick to these stages, as I reflect the obesity component and not the stage of lipidemia. And number 3, which is C, I classify according to the pain level between 0 and 10. 0 no pain and 10 is the maximum pain, and no touch. So this is the first poll question, which is very interesting because it will sense what system do you rely on in making classification of lipedema. I hopefully 30 seconds will pass and then we'll get the results.
Just to highlight this question, it could be a provocative question because we know now there is a lot of hot discussion about if there is really staging for lipedema or it's mainly based on the pain and so on. The Dutch Society of Phlebology or the German Society of Phlebology and Lymphology, they released recently guidelines showing the differentiation between the different phases of pain in the lipedema, and that's why we thought also to get the input from the audience on that. So I think we already might have some result. Khalid, if you can share it with us.
Yes, excellent. So it seems that most of you, around 70%, do the old stagings that we used to do, around 73% exactly, which is the same old stage. And the second and third take opinion, which is second is C and second is B. So this reflects that the old school of classification lipedema is still outcast to other, which is very interesting. Thank you very much.
So maybe we can have one question to Dr. Victor. Dr. Omar, as a vascular surgeon,
Yes.
Dr. Omar Farouk, I didn't have
Yes.
the time to introduce him in the beginning, but he's working in the teaching hospital in Egypt. Most of the vascular surgeons, not only from Egypt, but from the Middle East, actually globally, are studied under him in his department. He's also examiner in the Royal College in UK. That's why he was in the UK trip now doing some examination for the students. So he has a huge amount of work behind the education and sharing knowledge. He has his own platform, Vascular Online Training, which is I encourage everyone also to look at that. So do you have a question to Dr. Victor, Dr. Omar?
Yes, sure. Thank you very much for his excellent duplex scan. And my question is, how frequent does he see deep venous thrombosis in patients with lipedema? Does he think that they have a higher risk compared to normal population? And thank you very much for very nice demonstration of a high duplex skills.
Thank you, Dr. Omar, for watching it, for participating with us, and for the question. So far, we haven't noticed bigger incidence of deep venous thrombosis in lipedema patients. Not even the patients treated clinically, and nor the patients that have undergone liposuction. And in part, I believe that is because we investigate a lot these patients. So we try to stick to a protocol to try to avoid thrombosis with proper prophylaxis after the procedures.
Like 40% of veins, insufficient veins problem is very common, isn't it?
Yes. We're just talking here. The amount of varicose veins in several ways of or present the ways to be presented, like C1 and C2, at least C3, I think it's very common. C4 and C5, very less frequent. But here we tend to see varicose veins in almost 50% of the cases. And even though we did not notice deep venous thrombosis with more frequency in that. Okay?
Yeah. Thanks so much, Dr. Victor.
Thank you.
Really appreciate it a lot. As Dr. Omar mentioned, the skills of doing the ultrasound with the patient. So yeah, I think now, as we said, we do the multidisciplinary approach, looking at the different aspects from the lipedema patient. We finished the vascular assessment, and now the patient is eligible to do a liposuction.